Hey guys, it's me Ashil. To those of you who are coming in for the first time, welcome. And of course to my returning and loyal supporters, hey! Okay, so today we're going to touch base on the nursing aspect of this channel. As we know, it's nursing, beauty, life. So we've done a little bit of vlogging to expose you to some parts of my life. We've done makeup tutorials to cover the beauty aspect. And today, of course, we're going to talk nursing, particularly NICU nursing, because of course I'm a NICU nurse. So guys, if you'd like to learn a little more about my profession, a little more about what I do for a living, what my job entails, just stay tuned. But before you go, please like, subscribe, and share this video. And of course, don't forget to turn on your notification bell because you need to be up to date with the videos. Okay guys, so stay tuned. Okay, so I actually had a different direction for this aspect of the channel. It was my intention to do a little more vlogging and video tutorials, but these of course would have to be done at the hospital. So being the prim and proper individual that I am and law-abiding citizen, I decided to go through my CEO of the hospital because I wanted to ensure that I was keeping in with the guidelines of the hospitals in terms of filming, etc. Of course, I wanted to capture maybe some of the infrastructure and nothing confidential really, nothing, no patients' faces, no notes, nothing that would, you know, implicate anybody pretty much. But I was not granted permission. Anyway, so this kind of threw me off a bit. Of course I was discouraged, but this is something that I've wanted to do. This is something I've been planning for some time. So I just wallowed in my sorrows for pretty much the night and tried to come up with other ideas as to which I could bring this aspect of the channel forth to you guys. So it's not the format that I wanted it to take. I obviously wanted to show you a lot of what I do, but until then, we pretty much have to see my pretty face all dolled up. Okay guys, so today we're going to, like I said in my intro, talk about what happens in the life of a NICU nurse. So let's start with what happens. Okay, firstly, before we even dive or delve into that, what is a NICU nurse? So NICU, for those of you who don't know, stands for Neonatal Intensive Care Unit. So as the word pretty much explains, intensive care. So it's not a nursery where we deal with well babies. We deal with sick babies, so babies who cannot go home with their parents directly after birth for whatever reason or for whatever diagnosis have to come to us. So the neonatal aspect of the acronym NICU refers to an infant that is between the ages of 1 to 28 days. So any baby that is past 28 days of life would no longer be considered a neonate as opposed to an infant. So if your baby is ill and past the 28-day marker, they would not come to us in the NICU. They would go to, sadly, the pediatric unit because we don't have a pediatric ICU. If they do need intensive care, they will have to go to the adult ICU, right? So prematurity, that pretty much means a baby that is born before 37 weeks of gestation, and a term baby is born anywhere between 37 weeks and 40 weeks of pregnancy, right? So any baby that is born prior to the 37 weeks would need a ventilatory support, and this is one of our major cases. We do get a lot of premature babies. The youngest I've ever worked with is a 25-weeker. There are hospitals outside of St. Lucia which work with much younger premature babies, and they survive and go home. So with these prims, we have different categories. We have the micro primates, which are born as small as or as young as 23 weeks, 24 weeks, thereabouts. So these are really small. They literally can fit in the palm of your hand. And we have the older prims, like the regular prims, which are born at 26, 27, 28 weeks, thereabouts. So these prims, because the lungs are the last organs to form in a baby, because these babies are born prematurely, you find that their lungs are not properly developed. So because of that, we would have to provide them ventilatory support. And we do this by means of invasive ventilation or non-invasive ventilation. Invasive meaning that there is a tube that has to be placed into baby's lungs via the mouth, and then this machine delivers oxygenation and ventilation to the baby. Sometimes it breathes for the baby, depends on how severe the cases are, or just provides a little extra support for that baby. If baby doesn't need invasive ventilation, or once baby has gotten better after invasive ventilation, then we have non-invasive, and this can either be in the form of CPAP, which is positive pressure ventilation, some sort of ventilation that gives a little pressure to keep the lungs open, rather, in layman's terms. And once baby doesn't need any CPAP, then we would have regular oxygenation via O2 mask, or well, with us we use cannulas, which is the prongs which fit into the nose of the baby to, of course, maximize oxygenation. So this is one of the main conditions that we see on our unit. We definitely will discuss in detail a lot more conditions that I see or that we are presented with, but right now let's focus on what a day in my life as a NICU nurse entails. So the first thing which happens when I get to work in the morning, we do a handover. So the night shift hands over to the morning shift, gives the changes for the baby, tells what happened overnight, and of course you would need to know what's going on with your baby. You're coming in on the shift, so no matter what department in nursing, there is always some sort of a handover, or what we call a report. So like I said, you would get the changes that were made for your baby overnight, how baby passed the shift, what problems baby had, and any updates that is necessary to know to start off your shift, right? So these would all done during the first hour pretty much of the shift. Now we work 12-hour shifts, so 3 days a week. 3. Yes. So after this, you would obviously have to go take over your baby. So I'm just using the terms that we use at the hospital. So you take over your baby, meaning you go to the assigned patient. Of course, your charge nurse would assign your patient to you. Patients, I should say, because we hardly have one patient. Our nursing patient ratio is pretty much sometimes 1 to 3, can go as high as 1 to 5 in rare occasions, but possible occasions maybe 1 to 6. But yes, so after you have been assigned your patient, you would go to take over, like I said, and pretty much just write your initial assessment. So our initial assessment is a hands-off assessment where we document, and in NICU, well, in NICU in St. Lucia, I'm not sure how it works for the rest of the Caribbean, but definitely in the US, they have the electronic system of documentation, whereas we document a lot. So you would have to write how you took over your baby, what was the baby getting, were there any fluids in situ, was there any cardiac monitoring, just the general look of your baby, how did your baby look. So all of this would be included in your initial assessment of your baby. Of course, you have to do your safety checks to ensure that everything is good and proper. After which, you would need to check any new updates for baby in your doctor's notes. Is there anything that has to be done? Is there anything new that was added? So you need to keep up to date. Doctors are supposed to update you as they go, so whatever they write in the notes they should verbalize, but sometimes it doesn't always go as planned, so you need to keep abreast because it's at the end of the day it's your patient. So check our doctor's orders. Then you need to know what times babies are fed. So there are babies which are NPO based on their condition. NPO means nothing by mouth, so they are not feeding, would get all their nutrition via the IV fluids. You would have to check to see how much feed baby is getting, the type of formula baby is getting, if baby is on high calorie milk because we're trying to get baby to put on weight, if baby is on a sensitive kind of formula because of vomiting episodes. So you would need to know all of these things in order to deliver optimal care to your patient. And of course, one thing that is very important in any nursing aspect would be medication administration. So you need to know the type of medications that baby is on, the frequency of the medications, the route of the medication. So you pretty much need to know all your rights of your medication. Is it delivered via infusion, or it can be given via slow push? You will need to know all of these things, and of course you will need to know how to calculate these medications based on the baby's weight. So these are pretty much, and of course you know you have your managerial or ward duties, so paperwork and the storerooms, etc. So all of these fall into the day of a NICU nurse. I really wish that it was delivered different, and that we were actually in the setting to show you what happens and where what happens, but at least you would get an idea as to what happens in the NICU, and how we function as NICU nurses in St. Lucia. So if you have any requests that you would like to see in terms of nursing, of the nursing aspect of this channel, please don't hesitate to leave a comment at the bottom. Let me know what you think of this video. Please, let's get some interaction on, guys. And of course, you know, I appreciate your likes, your shares, and your comments. They mean a lot, and of course the encouragement is always needed. So we're pretty much done with this nursing video. I look forward to your feedback, please, and don't forget to subscribe, like this video, and don't forget to turn on the notification bell so you would be up to date with the new videos that I post. I'm going to try to make a schedule in terms of what comes out when, but I'm sure it's not going to work out, especially when school reopens. But guys, thank you so much. Stay safe, stay blessed, and I love you guys.